The future is looking very, very scary.
Tax credits that lower health insurance expired as we rang in the new year. Teresa, a single mother of 3, insures herself and her 2 sons, one with type 1 diabetes, who needs insulin, supplies, and several doctor's visits a year. Her oldest daughter now getting coverage through her college.
I have asked my kids that can work to get a job to help me pay for things like car insurance that otherwise I would have been able to do by myself. It's not fair.
The Affordable Care Act subsidies helped lower monthly premiums for millions of Americans who selected coverage through the marketplace. Teresa says she's now considering putting her 2 youngest on Medicaid, then covering herself with the ACA plan.
But how else do you plan to adjust?
Yeah, it's, rice and beans, ramen, meal planning, just being really intentional.
The tax credits became the central focus during the country's longest government shutdown, where Republicans wanted to revisit the subsidies later, but Democrats insisted on a tax credit extension.
I've resigned to myself to the fact that this is probably the new normal.
According to a KFF analysis, the independent source for health policy research, they found expired tax credits would result in an average 114% rise in premium costs. Choosing her same insurance coverage, Teresa saw in December her monthly premium go from $80 to $520 for January.
And I was left with $74 3 days before Christmas. And I didn't sleep all night. I tossed and turned, cried, panicked, had hyperventilations. But I won't lose hope. I keep fighting. I keep sending letters and calling my representatives and making noise wherever I can.
Alani Latang, Atlanta News First.